Welcome back at 8:15. A new drug could bring hope and rest to millions of Americans suffering from sleep apnea. The FDA has given approval to the Eli Lilly drug, known by the generic name Zepbound, to treat obstructive sleep apnea. The drug is currently used to treat obesity. Dr. Reena Mehta joins us this morning with details on why this has been approved for treatment for sleep apnea and the type of game changer this is going to be. Thanks for being with us, Dr. Mehta.
Thank you so much.
Happy New Year.
Happy New Year. Thanks for having me.
I haven't really been saying that, so Happy New Year to you. So let's first kind of backtrack a little bit here. For people who are unaware or don't really fully understand what sleep apnea is, how is that different from people who just snore?
Okay, so sleep apnea is obstructive sleep apnea, which means there is obstruction in your upper airway. And so what happens when you actually have obstruction is it's more than just snoring, you actually stop breathing for periods of time. And so that's concerning because obviously if you have periods where you stop breathing and then you wake back up, you're not sleeping well, you're very tired, you don't feel good. And so up until now, really the treatment has been using a CPAP machine, which we all know that can be not a very pleasant experience if you have to use it every day, but that's what we've had up until now.
And this drug, Zepbound, this Eli Lilly drug, had up until now been used for treating obesity. So that's one of the injectables that we've been hearing about over the last few years. Is that right?
It's a GLP-1 agonist, so it's tirzepatide, and so it's Zepbound or it's Mounjaro.
Okay.
You know, that's what tirzepatide is. And so yes, we've been using it for obesity up until now, and now the FDA just approved it for a new indication for obstructive sleep apnea.
So what is it the FDA found, and these studies showed the FDA, I should say, that this drug can also help with sleep apnea or treat sleep apnea?
So in the clinical trials, they looked at about 500 adults with obstructive sleep apnea who also had obesity.
Okay.
And so what they found over a 52-week period was that there was about a 45-pound weight loss in these patients and about a 50% improvement in their sleep apnea. So the thought is, because we already know it works for obesity, most patients with obstructive sleep apnea probably are overweight. And so if you're reducing their weight through insulin secretions and you're basically regulating their ability to manage their blood sugars, which makes them less hungry, which reduces their appetite, which makes them lose weight, then you are reducing some of the, I guess we'll call it fat or extra weight around the neck and extra weight around the abdomen. So if you're not pushing on those areas, then you're sleeping better because you're not having as much obstruction.
This sounds like an absolute game changer. We keep talking about how these injectable drugs used to treat obesity, diabetes and obesity, we're finding they're helping with so many other issues. So how much of a game changer is this one?
I mean, a huge game changer. And so if you have OSA, which we know many people do, if it can make you lose weight, it can make you feel better on a day-to-day, you're sleeping better, I mean, you're going to feel so much better. Now, I mean, these drugs are, like we already mentioned, there's so many new indications that are coming out for it.
Right.
What we don't know is long-term data.
Correct.
So, you know, we have the last few years and these studies that are super promising and really show the safety and efficacy of these medications. We don't have 20-year data. You know, so I guess what we don't know yet is what's going to happen. I will say, because of this new indication for sleep apnea and using Zepbound is great, it does not replace your CPAP machine. We're not at the point yet where we can say, okay, just throw away your CPAP.
Right.
CPAP is still considered the first line until we get more evidence, more data, and also you need to talk to your doctor whether you are a candidate for this medication, because if you don't have obesity, your insurance may not cover it.
This is really just interesting, if nothing else. Dr. Mehta, we appreciate your time this morning. You always bring such interesting medical updates, and we appreciate, or I do at least, I'm a little bit of a science nerd about some of that stuff. It's really cool, and we appreciate your time this morning.
Thank you so much for having me.
All right.